Okay, so here this slide is just an introduction to cardiovascular disease, so CVD. So it's the most common cause of death in the Western world. So it's kind of scary. But I'm just going to, I'll let you guys read these risk factors. I don't need to read them for you. Okay, but 33% of adults have high blood pressure. 80% no, but only less than half have it under control. Okay, cigarette smokers makes it worse. Cholesterol makes it worse. Diabetes makes it worse. Being overweight makes it worse. And now kids are overweight. So you can go to this website. You can read about this, but it's scary. Makes you want to make a life change. Okay, now let's talk about some disorders. So we have hypertension, which is also known as high blood pressure, arteriosclerosis, stroke, heart attack, aneurysm. Okay, so high blood pressure is when the blood pressure is like really high. So what's happening? For some reason, okay, the vessels have lost their elasticity. Okay, so your arteries are not as flexible as they used to be. Okay, lots of times it's due to plaque in the arteries, so arterial plaque, and that can be due to high cholesterol. Okay, so whenever you have a high blood pressure, what it's doing is putting lots of pressure on your arteries, so it can actually break off or destroy. Your blood pressure can be so high that it can destroy arterioles. Okay, so if it destroys the arterioles, it leads to a heart attack. If it's a coronary artery, it could lead to stroke. It could lead to kidney failure because it can damage your kidneys, the blood vessels in your kidneys. Now, the reason it's called a silent killer is you can have high blood pressure and not really know, because you don't have any. You don't feel bad because it's gradual. I mean, once it gets so high, you feel bad, but it kind of creeps up on you and you don't know that it's going on. So it's called a silent killer. Okay, now arteriosclerosis is also known as hardening of the arteries. It's a buildup of plaque in your blood vessels. Okay, so a plaque that's stationary. Okay, so it's like a plaque is just like something that shouldn't be there. Okay, and it makes the arteries narrower. So if this is a normal artery, look, the blood can go through here. The plaque narrows the hole, the space for the artery, the blood to flow through. Okay, now a thrombus is kind of like, this is a blood clot. Okay, a thrombus is a blood clot that's stationary, so there could be a blood clot in here. So a plaque that's stationary can cause a thrombus to occur. So a thrombus is a blood clot. Okay, if the blood clot breaks loose, that's called an embolus. Okay, and an embolus can move. It travels through your bloodstream, and if it clogs up an artery, that can cause a stroke. It could cause a heart attack. It could cause an aneurysm in your brain. So now we have to talk about an aneurysm. Okay, so a stroke can also be, they're also called a cerebrovascular accident, so a CVA. Okay, so usually we call it a stroke when a artery going to your brain is blocked. Okay, and if something's blocked, it's called ischemic because the oxygen level goes down. So that would be like sometimes they have TIAs, which is a transient ischemic accident. Okay, but if it bursts, okay, you can't repair it. So that's a hemorrhagic accident. So you're hemorrhaging, you're bleeding. Okay, so what happens, what's so bad about this, okay, is part of your brain starts to die because the arteries aren't getting blood to it and you have a lack of oxygen. Okay, symptoms of a stroke could include numbness of the hands and face, the inability to speak. Part of the face might get droopy. Okay, you might not be able to see, might not be able to form words. Okay, now a heart attack, okay, is called a myocardial infarction. Okay, so myocardial is the heart muscle, and infarction is tissue death due to the lack of oxygen. Okay, so oxygen to the heart's blocked, the cells start to die. Okay, that causes pain. Sometimes it begins with this condition called angina pectoris. So angina is when you start to have pain that goes down the left arm, and a coronary artery is like temporarily blocked, and that's what angina is. Okay, so the symptoms of a heart attack, they vary. Okay, so you could have pressure and pain in your left arm, your neck, your shoulder, your back. You could get dizzy. You start to panic because you can't breathe. Scary. Okay, now an aneurysm is a weakness in a vessel wall. Usually it's an artery. Your book calls it a ballooning of a vessel. So instead of the vessel staying nice and narrow and even, a region of it balloons out. Okay, so arteriosus, high blood pressure, can weaken the vessel, causes it to balloon. If it balloons too far and it just continues to get weak, it can blow, it can break. And if it breaks, you hemorrhage. Sometimes they're genetic, they're hereditary. Most of the time, it's an artery like the abdominal aorta, or the arteries leading to the brain. Okay, and there's not a lot you can do. Okay, so treating clogged arteries. Okay, so TPA, this is tissue plasminogen activator. It dissolves clots. Okay, so we can dissolve blood clots. We can treat clogged arteries. Okay, so different ways we can treat them. One is bypass surgery. So what they normally do for bypass surgery is they're going to take a vein, actually part of the great saphenous, and they bypass the artery. Like they create another route around that area. Sometimes we put stents in, and the book has a nice picture of putting a stent in. I don't have it. They putting a stent in. So a stent is just this cylinder that's made out of wire mesh, and it's put into the clogged artery, and it just opens it up. Another thing that they can do to treat clogged arteries is angioplasty, and what they do is they put a tube in that has a balloon, and then they inflate the balloon, and that opens up the vessel. And normally after they do the angioplasty, they put a stent in. There's lots of medications that you can take or that they'll give you to reduce your blood pressure. Okay, so disorders of the heart. Okay, so heart failure is really just when the heart doesn't work right. There's different things that they can do to treat it. So one thing is called an LVAD. So that's a left ventricular assist device. So an LVAD is going to help your left ventricle pump the blood out to your body. Okay, this is a photo of an artificial heart. Okay, so this is a total artificial heart. So it's two pumps that are gonna work like a heart. They can also do heart transplants that are a normal heart or a human heart. Okay, now on page 110, there's a bioethical focus. Okay, so it talks about heart disease in the United States and different things that are going to influence it. So I want you to read that because it's pretty interesting. Okay, so preventable risk factors, things that you can do that are going to get rid of heart disease. So one is the use of tobacco products. Okay, so it talks about nicotine restricts arterioles, that increases your blood pressure. Okay, there's lots of bad chemicals in cigarettes. Drug and alcohol abuse, obesity, sedentary lifestyle, poor diet, Stress increases your blood pressure. Another thing that you might not have thought of is poor dental hygiene. Gum inflammation, you can get bacteria and they can build up, and when they can enter the bloodstream and cause problems. Okay, so things that I want you to think about. Okay, so what's the function, cardiovascular system? What's the anatomy? Okay, so you need to know big picture stuff. How do we regulate heartbeat? What's blood pressure? What are common diseases and how could you prevent them? Okay, so I'll post other assignments here in a minute.